And now we have House File 1860, Representative Reyer.
Thank you, Madam Chair. And I do have an amendment to that.
First of all, you have to move the bill.
I'd like to move House File 1869 to be laid over.
Okay, and then an author's amendment.
Yes, Madam Chair. Author's amendment A1. Yep.
You're moving that?
Yes, thank you.
Representative Reyer moves the A1. You want to just let us know what the author's amendment does?
I sure would. Thank you, Madam Chair. The author's amendment adds appropriation amounts. And so for the Bridges program, it is an addition of 1.5 million over base. And then for the landlord risk mitigation program, it's a 100,000 one-time appropriation. So those are added. And in addition, we've removed section 2, which is permanent supportive housing for people with mental illness, because it's replicates another bill that is already in process, and because it really didn't fit with the scope of this bill.
Okay, so that is the author's amendment. Any discussion to the author's amendment? If not, all those in favor of the amendment, please signify by saying aye.
Aye.
Aye. Opposed, nay. The motion prevails and the amendment is adopted. Representative Reyer, to your bill.
Thank you, Chair Hausman. Thank you, committee members. It's good to have a chance to talk about House File 1869 today. This bill provides appropriations for the Bridges Rental Assistance and a landlord risk mitigation program. Where we live matters. Having stable housing allows people with mental illnesses to focus on their recovery and turn their attention to other goals like employment or education. Unfortunately, people with mental illnesses are much more likely to experience housing instability and even homelessness. Unmanaged mental health symptoms, job loss, inpatient mental health treatment, or an experience with the criminal justice system all increase the challenges that people with mental illnesses face when trying to find and maintain a stable housing situation. And unfortunately, as we've heard in previous testimony, homelessness has been getting worse in Minnesota. Even before the start of the COVID-19 pandemic, the most recent Wilder homeless count found a 10% increase in the number of people experiencing homelessness between 2015 and 2018, with a higher rate of growth in greater Minnesota. Just as concerning, there is a 62% increase in the number of people who are not staying in a formal shelter setting, and some of them for the reasons that we heard about just a few minutes ago. Most homeless adults also have a chronic health condition, with 64% having a serious mental illness and 24% living with a substance use disorder. And while eviction moratoriums at the state and federal levels have protected many families during the pandemic, there's a significant chance of a surge in the number of people experiencing homelessness once these moratoriums expire. House File 1869 increases funding for 2 programs to address these needs. One providing direct support to renters, and one that reduces risk to landlords. These programs are endorsed by the Homes for All Coalition. Now I'd like to turn it over to Sam Smith from NAMI to tell you about these programs, and then we'll have another testifier, Nick Rasmussen, speaking about his experience with Bridges. Thank you, Madam Chair.
Thank you. We have Sam Smith from the National Alliance on Mental Illness. Welcome to the committee. Please identify yourself for the record.
Madam Chair, members of the committee, my name is Sam Smith, and I'm the Public Policy Coordinator at NAMI, Minnesota. I'm here today to testify in support of House File 1860. Navigating a serious mental illness while also experiencing homelessness often traps people and forces them to rely upon emergency services, hospitalization, or worse, end up in jail or prison. Access to housing interrupts this cycle and allows people to focus on their recovery. While the factors that drive people into homelessness are complicated, the solutions are often simple. There is not enough affordable housing, and there are too few supportive services to help people transition from homelessness into a stable housing situation. House File 1860 invests in 2 proven programs that help people with mental illnesses and other barriers access affordable housing. Bridges provides housing subsidies to people living with serious mental illnesses while they are on a waiting list for Section 8 housing assistance. Among all homeless adults interviewed during the Wilder homeless count, we see that these wait lists are long, with 50% of respondents reporting they are on a subsidized housing wait list with an average wait time of 12 months. As with the Section 8 voucher, people on bridges rent an apartment at the regular market rates and pay 30% of their income for rent. The program provides vouchers to cover the balance. Bridges is administered by local housing authorities or other entities who manage Section 8 programs and is available in 70 counties in the Leech Lake, Mille Lacs, and Bois Forte tribal nations. These programs currently serve over 800 individuals and families with serious mental illness, have a home, with nearly a third of Bridges recipients being households of color. With tight rental markets, it can be very challenging for people with housing vouchers and other supports to find a landlord that is willing to rent to them. These challenges can be even greater for people with mental illnesses, experience with criminal justice, or folks with poor rental histories. Landlord risk mitigation funds respond to this problem by providing insurance from the landlord. If a tenant on a public housing voucher damages the property or fails to pay rent, the risk mitigation fund can offset some of these costs. Landlord risk mitigation programs funded by the Minnesota Housing Finance Agency are currently available in Dakota, Scott, Anoka, Washington, St. Louis, Crow Wing, Morrison, and Todd County, with 45.7% of tenants from the BIPOC community. Landlord risk mitigation funds help people with significant barriers find and maintain their housing. Both of these programs work, and NAMI Minnesota urges you to increase their funding. Thank you for your time and support of people with mental illnesses. I'm happy to answer any questions.
I have to tell you my experience with these evenings that NAMI arranges in our districts. NAMI brings clients together or family members and then invites the legislator in the area to hear their stories. And I can just remember this powerful experience this one evening where we're sitting in a living room and we went around the room and everyone told their story. And without exception, housing was the issue that was the thing that didn't enable them to get to a better place. One person in the room, one person had stable housing, and he credited that with years of a stable life. So that defining issue in helping to get to a better point in your life it just came so powerfully home that night as I listened to their stories in that living room. So thank you, NAMI, for arranging those opportunities for us. We now have Nicholas Rasmussen. Welcome to the committee. Please identify yourself for the record.
Hello, my name is Nicholas Rasmussen, and I reside at 6953 West 140th Street in Savage, Minnesota.
Welcome.
Thank you. I was a software engineer and entrepreneur. I worked often and slept little. In 2013, I experienced a psychotic break. It was 36 months from the onset of symptoms before I received the treatment I needed. During the interim, I had repeated contact with law enforcement, the judiciary, community members, and healthcare workers. Prior to getting the help I needed, I consumed massive amounts of resources for no real benefit to anyone. When my illness was finally identified and I received the hospitalization I needed, my illness had progressed to the point where I spent 2 months in a psychiatric unit at Abbott Northwestern Hospital at a cost of $176,525.40. I then spent approximately 2 months in an IRT center. I don't know how much that cost. While in the hospital, my home was foreclosed on. I was very fortunate that I was able to convince family members to move some of my things out of my house before the bank took it back, or I would have no longer had any possessions. On discharge from the hospital, I was homeless. I'm very fortunate that I had an adult mental health caseworker assigned to me, as he was able to make arrangements for me to reside in Scott County's transitional housing, which in this case was a duplex owned by the county. My relationship with my family had deteriorated to such an extent they were no longer willing to offer me a place to stay. Again, I was very fortunate that my case manager was able to get me a Bridges voucher, which gave me 60 days to find housing and would subsidize my rent. After much difficulty, we found a landlord who would work with the voucher in my now bad credit and criminal history. Without the Bridges voucher, I believe I would have ended up in a homeless shelter. Unfortunately, the Housing Choice voucher is not a readily available source of housing support. In Scott County, the waiting list, which recently opened up for about a week, had been closed for 14 years. Thank you.
Thank you for your testimony. It's always so helpful to hear people willing to tell their story to help us understand the complexity of the issues before us. Members, do we have questions of the bill's author or testifiers? Mr. Worth, do we have any questions?
Madam Chair, there are no questions in the queue.
Representative Reyer, to your bill. Final
Thank you, Madam.
comments.
Thank you, Madam Chair. First of all, thank you, Mr. Rasmussen, for sharing your story. It's powerful. It's so touching. I'm kind of recovering myself from the emotion of knowing and having it brought to life the importance of what we're doing here today. Because we have a great opportunity here. We can step up, we can address disparities in housing access, we can address the needs of people like Mr. Rasmussen and so many others who are counting on the state. So I'm asking you and hoping for your support to increase these appropriations. And I thank you all very much.
And we're all eagerly waiting for that target to come out on March 24th when we can make some of these decisions. So thank you, Representative Reyer. House File 1860 as amended is laid over.